Okay, let's unpack a truly startling fact we found. Nearly 72%. I mean, think about that. 72% of the colossal $4 trillion spent every year on healthcare right here in the U.S. is considered preventable.
Yeah.
For an audience like ours, that number just screams potential, doesn't it? What does that statistic truly signify about where healthcare is today? And why is tackling these preventable conditions such a massive challenge?
Well, what's fascinating here is that this statistic really highlights a fundamental mismatch. We have a system that's, overwhelmingly geared towards treating illness after it happens rather than actually preventing it in the first place.
Right, reactive versus proactive.
Exactly. And when you see that 90% of our nation's $4 trillion annual healthcare spending is swallowed up by chronic diseases, things like heart disease, diabetes, obesity, conditions the CDC tells us are largely preventable. It just underscores this enormous opportunity. This isn't just a health crisis, you see. It's a huge economic drain that, proactive measures could significantly lessen.
And that's precisely the space where this company, HealthCues, has stepped in. They're making it their mission, it seems, to provide comprehensive, accessible, and importantly, cost-effective preventive healthcare solutions. From what we've gathered, they're not just, talking the talk. They seem to be delivering actual tangible services. What exactly are they offering that makes this mission a reality for employees and their families?
Well, their approach is quite multifaceted. They offer things like teleservices, so you get remote consultations. They have advanced DNA screenings for really personalized health insights.
Okay.
Essential biometric screenings to catch risks early on. And then there's consistent, ongoing wellness education. But the key thing, I think, is that these aren't just generic, off-the-shelf programs.
Right.
They're specifically tailored. They're designed to resonate with the employees and their families, really trying to address their unique needs and challenges.
Now, with a model that promises such significant benefits, I can imagine HealthCues maybe wasn't met with universal open arms, especially, early on. What were some of the initial hurdles they faced convincing employers? Where did that skepticism really stem from?
That's a really perceptive question. The sources do indicate that employers, at first, found HealthCues offerings almost, too good to be true. That phrase came up.
Ah, okay. The classic skepticism.
Exactly. There was doubt about the practicality, the efficacy, and particularly concerns about whether employees would actually participate in these programs. Would they engage?
Sure, that makes sense.
It's a common challenge in the whole wellness space, getting people actively involved in their own health, especially when it's, voluntary.
So how did HealthCues manage to overcome that pretty significant barrier? How did they actually turn that skepticism into genuine buy-in?
They really doubled down on prioritizing transparency and, crucially, demonstrating tangible results. That seems to be the key.
Showing the proof.
Precisely. They didn't just sell a vision, they proved the dual financial advantages. For the employers, this meant showing significant payroll tax savings. That's a direct boost to their bottom line, hard to argue with.
Right.
And for employees, it translated into clearly demonstrable increases in their take-home pay, plus improved access to healthcare services they might otherwise, skip due to cost or inconvenience. It was really about showing, not just telling.
Okay, that brings us to what I think is truly remarkable here. HealthCues apparently boasts an exceptional employee engagement rate. We're talking an average around 35%.
Yeah, it's impressive.
To put that in perspective for everyone listening, the industry norm for these kinds of employee wellness programs, it usually hovers around, 9%?
If that, sometimes. Yeah.
That's a massive difference. What is fundamentally different about HealthCues' approach that unlocks that kind of participation? Is it just the direct financial kickback, or how they communicate, or something else that really sets them apart?
Well, that 35% isn't an accident. It really seems to be the result of a very meticulously designed strategy. And it directly addresses the unique needs of their target audience, especially, as you mentioned, the blue-collar workforce.
Okay.
What's really behind that number, I think, is a deep understanding of how to connect health benefits to tangible, immediate value for those employees. The monthly educational campaigns they run aren't just informative, they're designed to be culturally resonant, highly practical.
Making it relevant.
Exactly. They've found ways to link health directly to things like increased disposable income and reduced financial stress from potential medical bills. They use clear, actionable language, Think of it as making health choices feel economically sensible and personally relevant, not just another corporate program.
Mhm.
And they also seem to continuously evaluate and refine their programs based on actual employee feedback, which obviously builds trust and helps sustain that high participation.
That laser focus on the blue-collar workforce is particularly compelling. What were the distinct barriers this group traditionally faced when it came to getting preventive care? And how does HealthCues specifically address those?
Yeah, historically, this demographic often faces some pretty significant systemic hurdles. Things like limited access to healthcare facilities nearby, real financial constraints that can make even small copays a burden,
Sure.
and sometimes just a general lack of awareness about the long-term benefits of preventive health. Maybe it wasn't emphasized before.
Right.
HealthCues seems to confront these head-on. They work to make preventive healthcare not just understandable, but genuinely accessible and affordable. And this approach has that profound dual impact we talked about. It significantly enhances employees' overall health, and crucially, it bolsters their financial well-being by actually increasing their disposable income.
So let's drill down a bit on those financial benefits, particularly the payroll tax savings you mentioned. That seems like a huge part of the value prop for everyone involved. Could you maybe elaborate on how that mechanism works? It sounds like a really significant incentive.
Absolutely. And it's not just about some vague cost reduction. HealthCues helps employers implement or optimize arrangements like Section 125 plans. You might know them as cafeteria plans.
Okay, yeah, pre-tax deductions.
Exactly. These plans allow employees to pay for their preventive health services like those DNA or biometric screenings we mentioned, or even subscriptions to wellness education using pre-tax dollars.
Right.
So what this means is not only does the employee's taxable income go down, leading to more take-home pay for them, which they notice immediately, but it also directly lowers the employer's share of payroll taxes, specifically FICA and FUTA taxes. It's a clear, quantifiable financial benefit that goes straight to the company's bottom line.
Wow.
It makes the case for adoption very strong. It really is a win-win that removes a major barrier, cost barrier to participation.
That connection between health and financial well-being is just so powerful. But stepping back a bit, how do we see the actual impact of this kind of preventive care in the real world? Are there concrete examples from the sources that really demonstrate its effectiveness?
Yeah, and this raises an important question. What's the actual evidence for the value proposition of preventive care itself?
Okay.
Our sources do provide some compelling examples.
Okay.
For instance, the American Cancer Society reports that preventive screenings can cut colorectal cancer mortality by up to 53%. That's huge.
53%. That's incredible.
It really is. And from the CDC, we learned that lifestyle interventions for people who are, say, pre-diabetic can reduce their progression to full type 2 diabetes by an impressive 58%.
Wow.
These aren't just abstract numbers. They represent substantial reductions in serious illness, the associated long-term care costs, and huge improvements in quality of life. I mean, imagine an employee who might have faced a debilitating chronic illness now living a healthier, more productive life, all potentially thanks to early, accessible intervention.
Absolutely. Now, beyond their impressive engagement numbers in this financial model, HealthCues isn't shying away from innovation either. They're actually leveraging something that's, well, transforming industries everywhere. AI, artificial intelligence. How are they strategically integrating AI into their preventive healthcare platform?
Right. And what's fascinating here is how AI seems to dramatically enhance the user experience. It simplifies interactions with their healthcare app. For example, say an employee has an urgent health concern pop up.
Okay.
The AI-powered app can intuitively guide them toward immediate, suitable healthcare solutions. This might mean instantly locating a nearby urgent care center that's in network, or seamlessly arranging a telemedicine consultation right then and there.
Making it easy in the moment.
Exactly. It streamlines what can often be a confusing, stressful process. And that significantly boosts user engagement, satisfaction, and ultimately keeps people using the app. It makes healthcare feel proactive and responsive, not like navigating some bureaucratic maze.
Of course, whenever we talk about AI in healthcare, it's natural for concerns to arise. Things like accuracy, reliability, user safety. Those are paramount. How did HealthCues navigate those initial hurdles or potential concerns?
Yeah, that's crucial. HealthCues seems to have diligently addressed these apprehensions. They used rigorous internal testing, extensive validation processes, and perhaps most importantly, comprehensive employee feedback loops. They listened.
Okay.
This meticulous approach seems to have ensured consistent accuracy and reliability. And the reports suggest employees have particularly praised the intuitive design, the ease of navigation, and just the overall effectiveness of the AI-enhanced app. It indicates they successfully built trust through performance. They didn't just, roll it out. They refined it based on real use.
That makes sense. Beyond just the user experience side, though,
Yeah.
how is HealthCues leveraging AI in ways that truly set them apart in their, say, business operations or market reach? I'm thinking beyond just the typical buzzwords we hear about AI.
That's a great question. What's fascinating here is seeing how they're applying AI to very specific business development challenges. For instance, in sectors they target, like quick service restaurants or assisted living facilities,
Right.
AI helps them analyze things like demographic data, specific health trends within certain regions, even employee turnover rates. This allows them to pinpoint companies that would likely see the most immediate and significant return on investment from a HealthCues partnership.
So hyper-targeting.
Exactly. It's about hyper-targeted outreach, making sure they engage decision makers who are already sort of primed to understand the value proposition. This dramatically improves their marketing effectiveness, their lead generation, and ultimately their market penetration. It becomes a real strategic competitive advantage.
And HealthCues seems to have a very strong, almost urgent stance on AI overall. They appear to advocate for its widespread adoption across pretty much all business sectors, viewing it as absolutely essential for staying competitive.
They do. And they're not just advocating. The sources suggest they're issuing a pretty clear warning. They're saying companies resistant to integrating AI technologies risk becoming obsolete or, at the very least, significantly disadvantaged.
Mm.
They stress that early adoption can lead to significant strategic advantages, effectively letting companies set the pace for their respective industries. It sounds less like a prediction and more like an observation of the current market dynamics.
Looking at their trajectory then, HealthCues has seen really impressive growth, rapid and steady, consistently doubling in size year over year since they started. That's an incredible growth rate in any sector, but especially in healthcare, which, let's face it, can often be slow to adapt.
Absolutely. And to maintain that kind of trajectory and facilitate further expansion, they're being incredibly proactive and strategic about it. Their plans include developing robust partnerships with prominent payroll systems providers. That's a smart move for broad market reach.
Yeah, integrates right in.
Exactly. They're also actively exploring collaborations with influential private equity groups, not just for capital, but probably for expertise in scaling operations effectively.
Makes sense.
And of course, they're strategically expanding their internal sales team to meet the growing demand and directly address these new markets they're identifying.
And they're also being smart about where they're targeting their efforts. You mentioned HealthCues is focusing on these high potential sectors: quick service restaurants, assisted living facilities, fine dining establishments, the wider hospitality industry. What is it about these sectors that makes them particularly resonant with the HealthCues model?
Well, these sectors often have large blue-collar workforces. These are the very employees who historically face those access and financial barriers that HealthCues is specifically designed to solve.
Right, the core demographic.
Precisely. They also tend to have relatively high employee turnover rates, which makes employee retention and overall well-being a significant operational concern for employers in those industries.
A pain point.
Exactly. So the HealthCues model, with its dual benefit of improved employee health and direct financial savings for both parties, it directly addresses core challenges these businesses face. It creates a really strong strategic alignment.
So what does this all mean for businesses out there listening, maybe considering a partnership with HealthCues?
Yeah.
What's that compelling sales pitch at its absolute core?
Look, the sales pitch is undeniably compelling because it offers tangible, measurable benefits right away. Partnering with HealthCues offers direct financial advantages through reduced payroll taxes for the company. That's number one.
Hard dollars.
Hard dollars.
Yeah.
Then, increased take-home pay for employees, which boosts morale and retention, and comprehensive healthcare access that addresses a significant unmet need for many workers. Companies that have already adopted these programs, according to the sources, report substantial benefits, not just the financial ones, but also things like higher employee satisfaction, definitely reduce absenteeism, and a noticeable improvement in overall morale. It really positions itself as a strategic investment that pays dividends in both, financial health and human capital.
So to kind of sum it all up then, HealthCues really appears to be transforming the preventative healthcare landscape. They're making it accessible, affordable, and crucially engaging, particularly for that blue-collar workforce. And it comes with clear, tangible benefits for both the employers and the employees. It's a proactive approach to well-being that seems to be changing lives and balance sheets across various industries.
Absolutely. And this really leaves us with a provocative thought for you, the listener, to consider. Given how companies like HealthCues are successfully integrating advanced technology like AI into critical areas like healthcare, and doing so with such a clear, measurable impact, how might this paradigm shift reshape our expectations for personalized, proactive services across all sectors of our lives, not just healthcare?
Hmm.
And maybe, what responsibility do businesses, regardless of their industry, have in leading this charge? Leading the move towards fostering well-being, not just in health, but maybe in every aspect of service delivery and how they engage with their employees and customers. Something to think about.